Welcome, everyone. Welcome to the Pursuit Podcast. We have a special guest today, Dr. Trey Martin, who just so happens to work here at Pursuit also. So we're going to have a really interesting discussion today because we're going to talk about the Yips. I just heard about it like a year or two ago, and I didn't even know what it was, but Trey has a really good story to tell also. So Dr. Trey Martin is the Pursuit Sports Performance Specialist. He received his doctorate in physical therapy from East Tennessee State University in 2019. And then he also played college baseball at Trevecca University. And then he went on to graduate from Tennessee Tech in 2016. So he did his doctor of physical therapy training at East Tennessee State. He grew up in Clarksville, Tennessee, and he has worked with professional athletes from the Major League Baseball, NFL, running, triathlete, CrossFit worlds, as well as a lot of college and high school athletes from all different types of sports. Dr. Martin also did a doctoral internship at Champion PT and Performance, which is up in Boston, and that's where he got a lot of his overhead athlete baseball programs and experience, shadowing underneath physical therapist Mike Reinhold, Lenny Macrina, Dan Pope, and Dave Tilley. And this is where he kind of excelled his specialization in overhead athletes. And he actually just joined the Pursuit team in 2020. So it's been a blessing to have you on board also, and adding this niche market and this specialty to Pursuit. But what's one thing that you can tell the people who, for our followers, what's one thing that we don't know about East Tennessee State University?
Ooh, probably that there is a massive Olympic training center. It's actually famous and really well known for Olympic weightlifting. So we had the Stone family, I think it's Mike Stone, and I don't remember his wife's name, but they're world-class Olympic level PhD people. So we have a really elite program training Olympic athletes and weightlifters. And they also have the Olympic training center there for the U.S. bobsled team. So
nice,
wild, but yeah, there's a lot of big time athletes over there in ETSU training for the Olympics.
I did not know that, so that's great. So let's get started. So for many people who don't know about the Yips or what the Yips is, can you explain to them, what is the Yips? Because it's not just in baseball, it's really any overhead athlete. Some golfers get it, but regarding baseball specifically, what is the Yips?
So normally the Yips you see in baseball with 2 to 3 positions. So you see it in catchers with throws back to the pitcher. You see it with second baseman with throws to first, and then you see pitchers trying to pick off guys at first base too. So what you'll see is normally it's on a routine throw. So using my own experience here, I had it as a catcher, and I could throw it to second base if someone was stealing with no problems. Throwing back to the pitcher though, the sensation that I would get is you feel like you're going to throw the ball straight into the ground, and it's in your brain and it's ingrained that you're going to throw the ball straight in the ground, and normally you wind up sailing it high. So a lot of baseball guys get this. It's kind of a dirty word in baseball. You don't really want to talk about it. But at one point when I was at Trevecca, I think it was 4 out of the 5 catchers on the catching staff there, we all had the Yips at different points of the season. So yeah, it's difficult to describe. So when I was at Trevecca, I looked deep into it, looking for a solution to this problem that had started a little bit earlier on in high school, and there wasn't much information out there. I wound up calling some quack doctor out in California that had some weird tapping method that you could like tap your chin and do all this stuff mid-game, and he said that was going to realign your energies and fix your Yips. I tried it. It didn't really work. But so, yeah, you really just have this weird phenomenon of where the most basic task of like a throwback to the pitcher, that's a fairly short throw. You have this, it's like a mix of physical and also psychological impulse where you feel like I can't throw it back to the pitcher. And then you start worrying about it and you feel really anxious about throwing it. It's almost like you feel like throwing the ball back to the pitcher is like the same level of stress as like a T-Rex chasing you through the wild. Like, so that's kind of just a brief, like how it feels. Some of the physical responses too I had that were interesting was you would almost feel like a wrist like spasm. Like when you throw back to the pitcher, you'd almost feel like your wrist was like spasming down. Whether that be stress induced from, actually, let me rewind a little bit too, just how it started, just to kind of give people a background. And
yeah, I was going to ask, I was like, did like an injury happen and it led to this, or this just crept up with insidious onset? Like there was nothing that caused it.
Kind of a mix. So we were down in Memphis, actually. This is my senior year right before college. So everything was going well. There wasn't like, I wasn't worried about like any other situation. I had no life anxiety. We were playing a tournament in Memphis at this time. And right before the game, I remember like my shoulder feeling a little bit off, but nothing serious, like nothing a baseball person doesn't deal with. And in this tournament, and this was probably about as well as I've ever played in my life at this time. So I'm just highlighting that to say, like, I wasn't just stressed out having a bad time with baseball anyway. Like, I was going into this game with fairly good spirits, felt good about things, and it was in this game that I overthrew the pitcher in warm-ups like once down in the bullpen. Didn't think much of it. I was like, all right, whatever. And then in the game, I overthrew the ball back to the mound like maybe twice. So the other thing people notice with the yips is it's never as bad as you think it is. It's always worse inside your head. In my head, I'm like, oh man, everyone's gonna know I can't throw back to the pitcher. They're gonna notice. And really, it came down to like 2, maybe 3 throws a game. And for the most part, 95% of the time, it really doesn't even matter. You could skip it back to the pitcher. It doesn't really change the game. But I overthrew a couple, and I started thinking like, oh, this is weird. It feels weird. I can't throw. So I started ruminating on this. And
So
then
at this time, you could throw back the pitcher sometimes, but other times you threw it over, or every time was hard, you just found different ways to get it back to him.
every time was hard. But at first it was like there was just a couple overthrows and I felt kind of normal. And then I started thinking about this. I was like, okay, what's happening here? Why does this feel off? Throws to second were fine. I started to struggle a little bit once it gets in your head. Almost it was implanted. So for the rest of that tournament, I remember my coach at the time. He was a college catcher too, and he came to me and he was just like, "Hey man, like I struggled with this too in college. Like I'm gonna make you play the next day. Like I'm not gonna let you sit out and just like get away from this. You got to get back on the horse, basically." So I remember between games, I threw with my dad, like in the parking lot, like 1,000 throws to make sure I could throw right and try to fix it that way.
Could you
My coach,
throw good in the parking lot?
yeah, I didn't have any problems in the parking lot, but
So yeah, there has to be a psychological point to it
the
then.
next day though, I played fine. We played a doubleheader. I caught both games, and like I didn't have any overthrows. I felt okay, and so it would just kind of periodically come on where I would start thinking about it more and more. A couple things I used is like I could lob it and like kind of grenade toss it way up in the air back to the pitcher. That worked. Or I
Yeah.
could throw it as hard as I possibly could, and that would also get the job done. So
So hold on for a second before you go on. So how far is the pitcher mound from the catchers?
just 60
Or
feet.
60 feet. So outside of a game, you could go to the parking lot and have your dad stand 60 feet away, and you could act like a catcher, and you could throw it right back to him without a problem, or you still had a problem.
At first, yes. As it kind of went further on, like over the course of once it was really in my head, no. Like any type of warm up before the game, outside of a
Really?
game. Like,
Wow.
at
Okay.
first, like yeah, I could kind of power through. I could make it work. So yeah, it was super interesting though. It just seemed like it kind of compounded worse and worse. But the most interesting factor was this was towards the end of summer, so played in the
Still
next
in high
couple.
school. Still in high school,
Yeah,
right?
yeah, about
Okay.
to go to college. I got to Trevecca and I went all fall with no problems at all. Like, didn't even think about it. I could throw back to the mound. Like, it was weird. So it kind of went away pretty quickly, and I was like, all right, this is going well. You know, I didn't have any issues. It was still in my head a little bit, but nothing major. Then after Christmas break, I remember the first bullpen back in college. I threw one over in like a bullpen, and it just rattled off the shed that was behind the bullpen. I just remember thinking, "Oh crap, it must be back now." So I think
Wow.
we'll talk a little bit about risk factors at some point because I'm pretty convinced I know. I think there's a personality type that struggles from this the most. When I was in PT school, I was telling some of my classmates about this issue because it made me like I burn out of baseball from it. I was like, I don't even want to play anymore. This isn't fun. I wound up transferring schools. Like it really made the sport miserable for me. So I remember telling some of my classmates, I was like, hey, have you guys heard of the Yips? And most PT students, those of you guys don't know, very, very type A, very high-strung people, like perfectionists. You guys want hundreds on everything, so very high performer slash high anxiety type people. And there was 10 people in my class. Virtually everyone in my class that played a throwing sport had the yips at some time. So it
Oh,
was super
that's
interesting that I saw
interesting.
this correlation with, like, okay, these people that are already perfectionists, that they put too much pressure on themselves to succeed, they seem to have more personality factors that lead to the yips. I've since read a study that kind of confirmed that there are certain personality traits, like being a perfectionist or being very high anxiety type, high performer type, that manifest in you being more likely to get the yips. So I thought that was kind of interesting with that. But yeah, my
Yeah.
classmates had a very high prevalence of it, which small sample size, sure, but something to that maybe.
In your research into going into what is the yips, anything orthopedic that you found either from your experience or from research? Because it sounds like, and I think you and I agree on this, there's a psychological component and there's an orthopedic component that just so happens to be predisposed or cause this in elite
Mhm.
athletes. So besides being, type A perfectionists and stuff like that, and people who are striving to be the best, is there anything in your research or your experience that you've seen orthopedic wise structurally that you feel could be adding into this problem? Because again, it's not probably one thing. It's
Mhm.
probably a little bit of psychology, mental thought processes and stuff like that. And then also, is there any orthopedic stuff that you found?
So yeah, when I was up at Champion, Mike Reinold mentioned this, and he's for those of you guys that don't know him, he's worked with the Red Sox, worked with a ton of pro baseball guys. Like, his career has been built off of baseball injuries and treating that. So I remember telling him about my yips experience, and he was like, I think there's a significant thoracic outlet syndrome component to the yips. So thoracic outlet syndrome occurs, you can either have, we won't break it down too much, but you can have either a vascular or a neurological type of thoracic outlet. So you have your thoracic bundle through here, and nerves or vessels can get occluded, and that can cause issues downstream in your hand. So that's a super basic rundown version of it. So his thinking was that everyone that was a thrower was on some level of the spectrum of either severe thoracic outlet or mild. So we know when we throw, the scalene muscles that go right above this thoracic bundle, they hypertrophy. So they grow as we throw. And his theory was that as these muscles grew, it led to occlusion, and then you just don't feel right as much in your fingertips. And so I don't know for sure. I think it's kind of a chicken and the egg type thing. I think I felt a little off, and then maybe you make a poor throw. But I think there's also the cognitive component, the psychological component of, I think some people with different personality types from me, they make that bad throw and they just laugh it off. They don't really care. They don't think of it. So I think it's kind of twofold, where it's maybe a mix of thoracic outlet syndrome, where you have some type of neurological or vascular flow being interrupted in the thoracic bundle,
Yeah.
that could be leading to symptoms down in your hand where the ball doesn't feel quite right. We see a ton of MLB guys lately too getting like a cervical rib removed to correct these issues, or thoracic outlet surgery. So I think there is a working theory that it might be
So
part
do they get good outcomes after it?
as
I've
far as
seen.
the yips, I'm not sure, but for actually treating thoracic outlet, yes, yeah.
So do they end up getting back to being 100% performance? Have you seen that at all?
Um, I know Fultz for the Magic has had really good success. He had thoracic outlet syndrome. They removed that. I don't know if they really looked at it with the yips specifically, though. I think a
Yeah.
lot of like a lot of the MLB catchers and stuff that have had the yips, I'm not sure they get back to. I'm not sure if they're treating the yips with thoracic outlet surgery yet, unless they're super
Yeah.
symptomatic. I don't know. That'd be kind of interesting, though.
It is interesting because Markelle Fultz, the NBA basketball player, is well known, and he plays here in Orlando. He was drafted, couldn't make a shot. They said that he had the yips. That's when I first heard about the yips. I
Yeah.
didn't even know what it was, and he ended up getting surgery for it. Now he plays for the Magic, and he's doing great and stuff like that. So that's interesting. So it sounds like that there definitely is an orthopedic component to it and a psychological component to it. And, if you view it as an osteopath, dysfunction in the spine and in nerves can cause sympathetic, parasympathetic flow, not to get too complex,
Yeah.
dysfunction in the arm. And, I see it in patients with frozen shoulders. You can't just treat the shoulder injury. You almost have to treat the first rib, the neck, to change parasympathetic and sympathetic flow, whether it's manipulation, joint modes, whatever, that you can actually make changes that way. So I would love to read up on some of the research on this and see if there's anything orthopedic regarding this. Is it a combination of thoracic outlet plus elite athlete personality that
Mm.
adds into it? So treatment wise, so we kind of went over what is the yips. You got to tell your story and your kind of process with it. So to finish your story, what happened to your yips?
Well, I wasn't playing for a while, so I literally took like 3 years off from like even picking up a ball. I didn't throw at all. Then I got in PT school, and I was like, all right, this has been on long enough. I have no problems now. Like I can throw fine. I play like church league softball and can go play catch. So the interesting component is I didn't get to test out how it would look in a game situation. So we kind of removed both things. I didn't throw, so as we don't throw, the scaling muscles I mentioned earlier, they're going to atrophy because I'm not using them like I was. So I wonder if I had a little bit of, it could be twofold. Maybe orthopedically, I cleaned up from not throwing, and then also, but I also don't have the psychological pressure anymore of I'm not trying to perform in a college baseball game. So it would be interesting. I agree with you. I do think it's treatable. But I think there's not a ton of validated research on treatment approaches for it yet. I do think it makes logical sense that if you could change sympathetic outflow through things like manipulation of the cervical spine, do things like mobilize the first rib, and also develop approaches to kind of clear out, like treat it like thoracic outlet syndrome, as we would with a normal orthopedic case. I think that would help with success of things, and I think you would have better feel in your hands, and with that, you'd have better confidence of things. So
Yeah.
I think that might address it fairly well. And then also from like a psychological standpoint, like obviously we're not psychologists, so I have to put a big disclaimer on that. But I do think there's things like cognitive behavioral theory that we've seen where you can address it through more psychological approaches. How
It'd be
you
really
do that, like I said,
interesting.
I'm not a psychologist, don't really know, but
Yeah.
intuitively, I think it's treatable, and I think there's a way to fix this. But maybe we should challenge ourselves and be the ones to kind of go out on that path and figure it out. I know it's a huge problem for a lot of people. And I know in my own research, trying to find my own answer, there's not really much on it. I saw a nice piece written probably 3 months ago as the first pretty well explanation with some research added to it that I've seen. So it is kind of a new
Yeah.
area, but I think it is something we could address.
Yeah. Regarding treatment, I think it would be really interesting if you could take kind of the best of both worlds, have a multi-discipline approach to it from a psychological standpoint, how to teach these athletes how to manage the stress, the anxiety, and how to deal with that through changing their thought process, whether it's cognitive behavioral therapy. I mean, all these elite athletes at that NBA, Major League Baseball level go through some sort of sports performance counseling and stuff, teaching
Mm-hmm.
them how to deal with that. I wonder if we got that training on board with someone and we took the thoracic outlet type of stuff, if that we could show clinical outcomes to a point where the yips are gone in X number of months and stuff like that. I think the key from the orthopedic standpoint is, can you catch it early enough that we can make a change to the thoracic outlet? Because thoracic outlet's a complex case, neuro versus ortho, and can they respond to treatment or not? But I think that definitely we could definitely handle the thoracic outlet part of it and have some sort of educational process with the psychological. So it'd be really interesting, and maybe we'll have to team up with like UCF and put out some case studies and kind of look at that as a multidisciplinary approach, not just orthopedic, but also add in the psychological component to it, and then add in the orthopedic too. But anything else that you want to finish up talking about the yips? We went over your story. What is it? Some treatment options going forward now in like 2020, and how your treatment can be. But anything else that you want to finish up with, going over the yips?
Yeah, I guess I would just finish up thinking, just with the thought of, I would like to see, whether it be us or other people, I'd like to see more attention put towards the yips. I've definitely seen people like quit their sport, change sports, not enjoy their sport anymore, and then also not perform as well at the highest levels, Major League, NBA. I mean, it's a huge problem that doesn't really have a solution yet that's been repeatedly proven. So I guess I would just leave thinking that it'd be interesting to see if treating it like thoracic outlet, run that theory out, and then also improving things like sympathetic outflow with more manipulation or mobilization techniques. From just a theoretical standpoint, without much science to back that up, it makes intuitive sense as something that is treatable. So I agree with you that I think it'd be very interesting to try to put out some case studies with UCF and see if we can, tackle this issue. But I'm also just glad to get to share my story and give a little bit of insight on how it happens, who it happens to, and then maybe some potential solutions. So if you're out struggling with the yips, just know it's not just you. It's not all in your head. There could be a mix of ortho and psychological problems, but it is a real problem. It is real feelings that you're going through with the yips, and it's not just, as most coaches will say, oh, it's just in your head. Stop thinking about it. It's not that easy. It's a very complex issue. So I think we could probably go at great lengths to help tackle this issue and either eliminate or at least minimize symptoms people have.
Perfect. And again, if anyone has any questions for us about the yips, our treatment approach, you can put a comment in the comment box below or find us at pursuittherapy.com. I'm Dr. Ron Miller, and this is Dr. Trey Martin. You can send us an email, put a comment in the comment box below, or you can easily find us on social media or on the web. But I'm not letting you off that soon, because the best hair in physiotherapy has to answer the Fab Five questions. Okay, are you ready for this?
I'm not prepared for this, so all right, let's see what we got.
What is your favorite restaurant in Orlando?
Ooh, Bull and the Bear. Bull and the Bear for sure. For those of you guys that don't know Bull and the Bear, free shout out. I'm non-endorsed or sponsored by them, but it's over in the Disney area. It's in a hotel there, actually. Fantastic food. So that's my number one.
I think that's one of 2 Michelin star restaurants, right? In Orlando. It has a Michelin star, I believe. I ate there. It's excellent.
Yeah, bring your whole paycheck if you're going there. So
yeah,
it's not
but
cheap.
it is very, very good.
Yeah.
Second question: what book are you reading right now?
I'm actually reading. Sorry, what?
No, good.
I'm reading Traffic Secrets by Russell Brunson right now. I just finished, oh gosh, why am I going blank on this? By Viktor Frankl, Man's Search for Meaning. So I just finished that last week. So completely different, but little input on both books. Viktor Frankl wrote this book as his psychological experience. He was a Jew who experienced the Holocaust, and he was in Auschwitz, and he just kind of talks about the physical and psychological toll. So really interesting read, one of my top 5 all time. And then Traffic Secrets by Russell Brunson, given to me by Dr. Miller here. It helping me learn how to build funnels and sell online things better. Not quite as interesting unless you're trying to make some online sales, which at some point I'd like to. So it's very interesting to me. So those are my 2 right now.
So you may not know this one just because you're new to Orlando, but what is a small up-and-coming business that you love that you've seen in the Orlando area that we could reach out to the CEO and talk to them about, or the business owner?
Gosh, I don't know if I have a good one for that. Up and coming. Pursuit Physical Therapy, I guess. I don't know.
That is hilarious. You know that you're the 4th person that says Pursuit. I just have to go interview myself next.
In fairness, I've been quarantined since I moved here, basically. So there's a lot of local restaurants I love. I will give a shout out to my gym I go to called the Weight House. They're kind of up and coming, awesome place. Nick McFarland's the owner there. It's 24/7, good powerlifting gym. That's my favorite place right now. But in fairness, I haven't been allowed to leave the house in 3 months. So.
That works. That's good. So 2 more. What is one thing in healthcare that you want to see changed?
Ooh, pretty easy here. I think the body, as we mentioned, functions quite as a system. I think there's always components of neuro, ortho, mental, physical, psychological, So not to get too kind of granola and hippie with it, I wish that medicine and healthcare was more, I don't want to say holistic because that sounds cheesy, but I wish we looked at the whole person more so than us always dividing into like, oh, I'm an orthopedic doctor or I'm a neuro doctor. I think we should all be doctors first and look at people as a whole and kind of integrate different systems better. I think we all in school like pair off into like, oh, I'm a knee joint specialist or I'm a rheumatologist or a endocrinologist. So I think it'd be very useful if we had better interplay between all the systems because like we mentioned with thoracic outlet syndrome, if I treat it as a psychologist only, I'm not going to get great results. If I treat it as an ortho only, I'm not going to get great results. So I'd like to see more integration and more maybe of a team approach where we all have better networks and stuff like that.
Yeah.
So that'd be
totally agree. Totally agree with that.
And
Okay.
health insurance needs a major rework, but that would take like 3 hours to talk
We
about.
could talk a whole session about that last question. So last question, what is one thing that you like and dislike about your boss?
Oh man,
I'm just joking. Yeah. You don't have to answer that one. That's hilarious. I was waiting for your facial reaction on that one, so it's all good. But anyway, we'll post this live. We'll share this with everyone. If anyone who's watching us right now is dealing with the yips or has questions about it, again, you can contact us. You can put a comment in the comment box below, or at least find us online at pursuittherapy.com. Thank you, Trey, for taking time out to tell your story today. And we're going to try our best to help others that are dealing with the yips get some progress and some information out there about it, and to let them know that there is hope with it and you can overcome it. So just let us know if you have any questions. Thanks again, Trey, for taking time out of your day to do this. And we'll talk to you guys soon. We'll see you.